Ptosis. That's how we are going to pronounce this. It's not ptosis. So make sure you pronounce it correctly. Ptosis means to fall. It's a Greek word which means to fall. Abnormally dropping of upper eyelid is called as ptosis. In normal case, our upper eyelid covers 1/6 of the cornea, which is actually 2 millimeter. But in the case of ptosis, it will be more than 2 millimeter. Ptosis can be congenital or it can be acquired. So there are basically two types of ptosis. Congenital, which is by birth, and acquired, which further can get in your life. Congenital ptosis, it occurs mostly due to maldevelopment of muscles. So let's just understand it. In the opening of our upper eyelid, two muscles are involved. This is your upper eyelid. Here are two muscles that will play a very crucial role in opening of the upper eyelid. Those two muscles are the molar muscle and the other one is the LPS muscle. The main muscle which play a vital role in opening of the upper eyelid is this LPS muscle, and the minor role is played by molar muscles. So maldevelopment of both of these muscles can lead to congenital ptosis. Simple congenital ptosis. So the congenital ptosis can occur in the form of simple congenital ptosis or maybe in the form of blepharophimosis syndrome. So blepharophimosis syndrome is actually a congenital condition where the eyelid opening is abnormally narrow but horizontally and both horizontally and vertically, and it often comes with the ptosis and poor development of the eyelid muscles. Patient may have a widely spaced eyes and a flat nasal bridge. You can see in this picture. It's usually seen in a genetic syndrome which we call as this blepharophimosis syndrome. Marcus Gunn winking syndrome. It's really interesting syndrome. You can Google it or check it on YouTube. There are some videos available. You can see it more clearly in a visualized form. So, in the case of Marcus Gunn winking syndrome, normal connection between the nerves that controls the jaws and the eyelid. This causes the eyelid to drop and sometimes wink when the jaw moves. So basically, when the person will open his mouth and will move his jaw, his eyelid, which may have ptosis in it, will move upward. All right. So a person with congenital ptosis might also have Marcus Gunn winking syndrome. Let's move on to the acquired ptosis. Acquired word means that develop after birth, often due to external or environmental factors. So acquired ptosis is further divided into the four types. So acquired ptosis can be neurogenic ptosis, can be myogenic ptosis, it can be aponeurotic ptosis, and can be mechanical ptosis. Neurogenic ptosis. It occurs due to the lesion in nerve. It may occur due to third nerve palsy, third nerve misdirection, and Horner syndrome. So, what is Horner syndrome? Let me explain briefly. People with the Horner syndrome have three signs, all on the same side of the face: dropping of the eyelid, which is called as ptosis, a constricted pupil, and the reduced sweat. So it means person having the Horner syndrome will have reduced sweat, and this all these things will be on the one side of the face, ptosis and the constricted pupil. It's not disease by itself, but rather a sign that something deeper is going on, like an injury, tumor, or even a stroke affecting the nerve pathway from the brain down to the chest and back up to the eye. So if you see someone with a droppy eyelid and a smaller pupil just on the one side, Horner syndrome might be the part of the puzzle. Alright, now let's move on to the myogenic ptosis. It is the defect of muscle. The defect of muscle leading to the ptosis. So defect of muscle or defect of myoneural junction. So myoneural junction is actually a neuromuscular junction, is where a nerve connects to muscle and tell it when to move. So its defect can also lead to myogenic ptosis. It may occur due to myasthenia gravis, myotonic dystrophy, ocular myopathies, and simple congenital ptosis or blepharophimosis syndrome. Other type is aponeurotic, a defect in levator aponeuris in the presence of the normal muscle function can lead to aponeurotic ptosis. So what is levator aponeurosis? Levator aponeurosis is a thin, strong sheet of tissue that connects the levator muscle to the upper eyelid. It acts like a tendon or a rope, helping pull the upper eyelid when you open your eye. So, involutional or senile. Involutional and senile means with the age, and traumatic disinsertion of the levator aponeurosis can also lead to aponeurotic ptosis or post-operative due to drug action on aponeurosis. The last one is mechanical ptosis, which is pretty explainable with its name that it occurs due to any kind of weight on the upper eyelid, especially in the case of inflammation or tumor can lead to mechanical ptosis. Now let's talk about the treatment of the ptosis and how you can determine while the ptosis is severe or it's mild or it's moderate. So, in order to see whether the ptosis is mild, moderate, or severe, we will see the marginal reflex distance. What is marginal reflex distance? Marginal reflex distance is a distance between the upper lid margin and the light reflex. In the case of mild ptosis, there will be the 2 mm drop of upper eyelid. In the case of moderate ptosis, there will be 3 mm drop of upper eyelid. And in the case of severe ptosis, there will be 4 mm drop of upper eyelid. You can just see here the picture. And now let's talk about treatment briefly, how we can simply treat the ptosis. And the treatment actually depends upon the etiology of the ptosis, the degree of the ptosis, and the function of the levator palpebral muscle. So mostly surgeries are being done. There are different types of surgical procedures that are being done for the treatment of ptosis. That's all for this video.